Welcome to the School Leaders Podcast. My name is Dr. Gastred Harrigan, the podcast for current and emerging school leaders, those who support and supervise them. You will hear from passionate educational leaders who are transforming their schools, communities, and creating positive outcomes for students. I will also share my personal reflections and tips from over 15 years as a school leader. Together, we will talk about how to level up our schools and leadership practices. Hello, welcome to the School Leaders Podcast. This is your host, Dr. Gastred Harrigan. Before we get started with today's episode, I want to encourage all of our listeners to join the School Leaders Podcast community on Facebook. There, we continue and extend our conversation from the episodes. Also, don't forget to subscribe to the podcast so you can be notified whenever a new episode is released. Today, I have a special guest, Charle Peck. She's the co-creator of Thriving School Community, a revolutionary program designed for schools to improve mental health with over 20 years of education and mental health leadership experience. She has the unique lens of both a certified teacher and a licensed clinical therapist specializing in trauma. Charle also holds a master's degree in education and a master's degree in social work. Her role as a high school teacher, coupled with her work with children and families in crisis, gives her an incredible insight into solving youth mental health problems stemming from our schools. She is the co-author of Improving School Mental Health, the Thriving School Community Solution, and a global keynote speaker delivering powerful messages of hope to educators. Join me in welcoming Charle to the School Leaders Podcast.
Hi, how you doing? I'm glad to be here.
Yes, thank you for joining us. To get going, just tell us a little bit about yourself.
Yeah, I mean, honestly, education is in my blood, and I didn't think it would be early on as a youth when I was a mess. But we have tremendous work to do in mental health. And I do believe that schools are the resource we need to get the reach that we need with the kind of change we need in our culture. So I'm just excited about doing that. I speak, I do a podcast, just trying to get that word out so we can all do this darn thing together. Yeah.
Yes, indeed. And, and I appreciate you coming on the podcast and sharing, and we'll be sharing all the, your experience and insight. Share some of the lessons you've learned. I know you're a teacher and you're also a licensed therapist. Share some of your lessons, some of your experiences providing mental health services and support to students in schools.
Well, the first thing that comes to mind is a student that showed up in front of my desk when I was trying to get my notes ready for my next class, and his name is Ryan. We'll say Ryan. It's not really his name. But Ryan represents so many students that educators will understand. And so as I'm ready to get on with my next class, there's a very short period of time, and I look up and I see him, and he's usually very put together well and he's very involved in the class, but I could just see something was off. And so I'm like, hey, what's going on? And he said, can I talk to you? I didn't have time to talk to him. I didn't have any time. I had 30 students about ready to come into my class. And so I said, can you go talk to the school social worker? And he said, but you're the only one I trust. And to me, that is the catalyst to what we need to do in our schools, in our homes, in our communities in order to start rebuilding mental health. And so when I went to go and get my Master of Social Work, it was so that I could understand the structural issues going on with our schools. I mean, I had taught at a residential school before. I was actually a sub. I was there for a couple of years as a sub, but I was there all the time. And so the idea of generational trauma was kind of at the forefront. I got to experience that. So there truly are structural issues coupled with experience, and then being in that situation with students having so many problems showing up, and I got to teach about mental health. It just was coming together for me to say, listen, we need change here, and we need to do that now because we're suffering. And that, by the way, was before COVID happened.
Wow. And yes, you're right. Before COVID, we had a lot of trauma, and definitely COVID have really significantly impacted our community. And you just mentioned generational trauma. And in my school, oftentimes the population I serve, the nature of my population, oftentimes I see that generation of families. Usually, some of those trauma goes from generation, from grandparents to the mom, dad, and then now I have the child. And often we struggle with how do we help the child? And ultimately, and as we put Band-Aid on the child, we are discovering sometimes they go back home, and that whole cycle continues as much as we do some work at the school. How do you think, when we talk about generational trauma in your work, what can school leaders do to help with that generational trauma?
Well, schools are the epicenter for how we're going to shape our society. That's just especially public education. And so leaders need to learn. They need to learn. They have to be skilled. So here's what's happening in our schools right now to help try to deal with mental health. We clearly are in a youth mental health crisis. That's clear. That was identified by the Academy of, it was declared a national emergency is what I'm trying to say in 2001. All right. And from the Pediatric Association. And so the reason I say that is because we have been trying to actually solve that problem for decades by throwing SEL at our schools and trying to do programming there. And it's funny when you throw these questions at me, my mind goes a mile a minute, and it's hard to get some of these ideas out because I have so many of them that have stemmed from the work that we've been doing. And so one of the things that we've been trying to do to solve the problem is try to equip the students. And so we're teaching them SEL skills. We're teaching them to be resilient. We're teaching it as a separate classroom. So now we've got inconsistency with people who have varying degrees of knowledge and experience. And so we're sending them to a different class or learning new curriculum. And essentially, we're trying to equip kids. And the problem is it's not working. We're still in a crisis. And so we need to equip the adults in these kids' lives. And because of something called the spillover effect, whatever they're experiencing at school is then spilling into what's going on at home. And if they're struggling at home, it spills into our schools. And so that's why when you're in leadership, you have to understand that dynamic is important. It's not about talking about this problem anymore. We all know what the problems are. But instead of us still throwing SEL skills and resiliency skills at our kids and expecting them to thrive and function in these environments that we throw them right back into with burned out teachers and stressed out parents, that's just not going to work. So we have to do something different. So leaders just need to do something different. And we say everybody has to be skilled. And that's an immersive cultural experience. And that's when we'll see that long-term sustainable change.
That's awesome. That's powerful. Yes, leaders have to be skilled. And as you indicated, we have to empower everyone in the building, including the families, to be able to really break, for lack of a better word, that generational trauma. You just released a new book entitled Improving School Mental Health, the Thriving School Community Solution. Share with us the main points and the message behind your book.
So because I've been in the classroom and know how busy it can be for educators, we had to come up with a solution that was so easy to reflexively do instead of get great PD that we love and then get this big binder, that goes, we take it back to our classroom and it goes back on your shelf. And it's so daunting to have to go dive back into that to see how it's going to work into your day. So we had to come up with a solution that was so simple that we could reflexively remember how to use skills to make an impact. And so if you can imagine, I always explain it like this. Dr. Cameron Caswell and I, she is a doctor, she's an adolescent psychologist, and she is a co-author with me. And so it's like we would have these conversations and would take this information that was like a 25-page report, and we would synthesize it down to one paragraph and essentially make it so understandable so that anybody who is equipped with these skills in this way, the way we deliver it, can immediately start using it. Because if we have to think about it when we leave our PD session, it's not going to get done. And we also had to make something that was so easy to do across the board that if you're a pre-K teacher or a high school teacher or a student or a parent or a marginalized person in our society or somebody who thinks that they have the highest status, we're all on the same playing field and we all are equipped the same way with these simple reflexive tools that are going to make the shift when we all engage in them together.
And that's important to have that whole community, that school community, to engage in these shifts together. As you indicated, if we are going to create the type of trauma sensitive type of school, the type of school that's going to really help our kids to deal with the challenges and the baggages that they carry, it really going to take, and I'm glad you wrote this book and to empower school leaders and educators. We have to make that shift together, and we have to bring everyone along, because again, each person that sits in the building, the same way as the Ryan kid you mentioned earlier, Ryan felt comfortable, trust you, and you had to be empowered, right? We have to empower teachers to be able to at least do the initial conversation, conversation with our child before maybe redirecting them or taking them to the school social worker. Thinking about the PD and some of the resources you provide in the book, obviously to all the school leaders and mental health and emerging leaders listening, I encourage you, go get the book and see some of the things in there. So go and get the book. But if you can share one or two shifts that you share in the book, or strategies or practices for our listeners that you think are critical, that everyone in the building should make together.
Yeah. So, I mean, a lot of them pop up in my head, but let's get one that's really tangible. So let's say you're working with a kid who's not showing up to your class, and you don't know why. And you're the one who has a relationship, because, by the way, teachers are great informants. And so we need to lean on them as part of our mental health team more than we ever have. And we provide relief to the system there. But one of the first things I say is, listen, there is the ladder of conflict is something that we climb when we are frustrated with somebody else. So this could be a student, this could be a colleague. By the way, this could be a subordinate, or this could be somebody who's in a position of power. But what we can do is understand that when we climb that ladder of conflict, it's actually a visual that we created. Every step of the rung that you go up, you are contributing to the problem more, and it's harder to get down to the solution the higher you climb. You are not going to control what that other person is going to do. They might climb really high up the ladder, but the real power is staying at the bottom of the ladder. So when I was working with kids who, I'm telling you, they were in crisis. We're talking teenagers with their families who had terrible experiences, who ended up in my care at a hospital, a crisis unit. And the ladder of conflict is something I visualized when they were starting to get emotional and dysregulated. But when I was able to stay down at the bottom rung there, they felt safe to engage. That number one thing that we're talking here, when we're talking about trauma informed, is creating a safe space. And if you're a leader in a school or a district, you better believe that is in your best interest to create safety for your staff. That is number one, because that will trickle down into the whole culture of your school. And the next thing I would do is I would use another tool and think about what is in the circle of your control. So when you're in it and you have all of that emotionality going on, not only do you envision that ladder and see yourself climbing down the ladder and staying at the bottom, we then want you to picture your circle of control. So what are some things in my circle of control? So when we do PD, we go through all those things that you have in your power. And then we go through things that are outside of that circle of control, that's outside of your power. And you are not going to change that. But you can do everything you can within your own circle of control. So just being able to see that and visualize that helps us stay in that moment and make decisions very quickly around it. And again, there's other tools we could pull in and scenarios that we would dive into, but those are just two very quick ones that we use a lot.
Creating a safe space in a circle of control. As a school leader, I'm often challenged, right, with implementing district initiatives and also looking at the data, the challenges that are at the school, and especially around mental health, and trying to balance the two. I would love to say often both align. Sometimes they're in conflict with each other. And so to all the school leaders and principals that are listening, in your opinion, you talked about safe space, and I think that's very important. And you also talk about circle of control. For those leaders, within their circle of control, what is, besides maybe creating a safe space for kids, what is one or two more things that they could or should implement to really help begin to foster an environment to meet students' mental health?
Yeah. So I always start with the adults. I would tell leaders to say, listen to your staff, listen to their needs. The number one question we should be asking tomorrow to our staff, especially when they're struggling noticeably, is say, what do you need to do your job better? And how can I help get that for you? And anybody I've talked to, and I challenge them, I say, what happens when you can't get that need met for them? And they're like, don't say no. Let's figure out how we can make this happen, because usually they do have really good requests. I always tell this story too. We had an elementary vice principal who got a great budget, and her staff complaining about how their students lose their pencils all the time. And so she was like, I'm going to order a bunch of pencils and send them to the next staff room. And I can't wait till they see it, because I want them to know that I got their back. And they were all, not all, some of them, many of them were disappointed. And so when we talked to the teachers, of course, the teachers said, well, I already spent my own money on pencils. I don't need that. I really wish she would have asked me what I needed, because then she could have helped me that way. And that would have been easier. And I'm telling you, these are not big asks that these teachers have. They're not typically big asks. And if they are, we need to listen even more, because typically teachers are really good at managing themselves and compartmentalizing them. So the number one thing I would say, in order to support your students better, support your staff better. And that's not teachers only. That is support staff. That is people working in media, library. That's people in the front desk, attendance, right? Like everybody involved. Ask them what they need to do their job better. And what happens from that is, not only do you help meet their needs, you also make sure that they feel heard and validated and important. If they don't feel important, they don't want to be there. So there's a lot there, but that's such a great question. That's what I would say.
No, I think that is very key, because I don't know where I stole it from. I usually would say to my AP and to other leaders, if you don't feed the teachers or the staff, they're going to eat the kids. And so yeah. I think it's very important to start with the adults to build their muscle and meet their needs. As you said, listen to your staff. And it's important you say that, because for us, we also have an adult cell plan, and it's really all about the adults in the building. And with that same thing you just said, because few years before that, or every year, we look at what is the need, what is all some of the things the staff or the teachers are asking for, or they're stressed about. And around mental health, we always have cell days, and every year it varies. Some days it's just doing some mindfulness activities. Other days it's partnering with some of our local partners and to bring in massage therapists and aromatherapies, just different things to really help them manage their stress. One year when we were coming out of the pandemic, we did financial literacy to just help them manage because we have young teachers. We want our teachers to get paid more, but sometimes the money doesn't go far enough in helping them and teaching them how to manage their money, because if they can manage their stress, manage their own personal challenges, that would help them. And what I find interesting, and many, especially the young teachers, came to me and says, yes, this is what I needed to hear because I'm struggling in that area. So I think what you said is key, starting with the adults, listening to your teachers, to your staff, to see what the needs are. I like the example you give about, the principal AP went out and bought all these pencils, but teachers already took care of that themselves. And it's very important. It crystallized the point of listening, making sure you're meeting that specific need. Now, if we could shift and talk really and share some ideas from your book for district leaders and policymakers, what kind of policies or procedures, interventions they could institute to help support students and staff mental health in our public schools? Yeah.
So as far as the very first thing I start with is we need to like I said before, we need to make teachers better informants, because they naturally are really good at getting in tune typically with their kids, unless they need some skills, right? Sometimes they just need some skill building. But so we need to be able to not only have them share that common language, and they don't have to be therapists to do that. That's where I come in, is I've got the teacher lens and the therapist lens. We simplify it. They don't have to be therapists. I did that so that they don't have to. So what can happen is not only do we make them informants and have that common language, we set up a system that is so easy for them to send kids on when they are concerned about it. So here's what's happening. We have 19%, only 19% of teachers are actually referring their students when they're concerned about their mental health to the school social worker or the school counselor. So that means there's a disconnect with that process, because they don't have to deal with that big stuff themselves, but they feel like that kid, Ryan, who came to them, that's the one, you're the teacher that kid trusts. So they want to take care of that kid. The problem is when they do send them on, even if there is some kind of system, if they don't hear back from the school social worker or any of the administrators, once they have referred the student, they don't trust that kid's being taken care of. So they won't do it again. And then they've lost trust in the system. And again, they don't feel heard. They don't feel valued. And then they're like, and then you're not looking after my kid. So guess what they're doing? They're burdening themselves. So when we go back and talk about what should they focus on as a leader, a district leader, you need to look at all of the buildings you have and what is their protocol for referring students. Isn't it? If it's so simple that teachers can quickly access it, do it, and be reminded about where it is all the time, that system will be much better for kids.
That's very important. Making that system very simple for teachers, because again, teachers are pressed for time. Very simple to refer a child to the therapist, the social worker, to the family therapist, depending on the structure of the district or that school, making that system and that process easy. And also the feedback loop, making sure that there is a way they can quickly check to see what has happened, whether it is a quick email update, whether it is they go into a easy system to check, or whether for us, we have every other week where we have collaborative meetings where social workers, family counselors come together and really give updates on different kids and different cases that were referred that we were working on. Whatever that system looked like you indicated, removing those barriers, making it simple, clear. So as you said, then the teacher feel, I refer so-and-so and so-and-so is getting the help. Oftentimes the social worker is doing the work. The information loop or the feedback loop is not clear. The system is not clear. And hence they don't feel as if their kids that they sent are getting the necessary help. And I think that is very important. Thank you for sharing that. Sure. The audience for this podcast are emerging and current school leaders and principals. How can school leaders take better care of their own mental health?
Yeah. And I always caution about the whole self-care improvement movement that we're in, because there's a lot of pressure even there, always having to do something better, be better, do more, right? And so we're so cautious about that language, even though people who are in that field, I was using that. But there's incredible pressure to do that, especially these days. So one of the things we do is we have a set of skills, and there are 9 skills, but the first 3 sets of skills are all about me. They're all about how do I manage myself? How do I manage the insecurities that show up, and how do they show up? And how do I know when they show up? And then what do I do about it when it does? We look for patterns within ourselves. We look at our own roles at home and how we're bringing them into our school buildings in our roles and how they're showing up. And that whole word trigger and trauma, these are things that have gone through our schools, like the word resiliency, like all of these buzzwords that kind of get a bad name, that go kind of through that eye roll test from PD. We're like, oh my gosh, I have to hear that again. So I hate using the word trigger, but what I want people to understand about this is when you show up in this space and something is charging you emotionally, that comes from somewhere. And so what we teach is, listen, we know times are tough. We don't want you to give up because we know there's hope, but we also want to validate what you're experiencing. So we actually teach them, and this is where my trauma training comes in. Again, they don't have to be therapists, but I teach them how to notice that when that comes up. Is it coming up at a certain time of day? Is it coming up with a certain person in your space when they enter that space? We all know how things change when just one person enters the room or comes over the announcements, or you just hear the name. It can charge us. And so what we teach is get very attuned with yourself and have strategies that works for you. Doesn't have to work for everybody, but find your strategy so that you can function into your entire day. So one of the things that we talked about earlier in this interview is about like Wellness Wednesdays, or let's partner with people in the community. That's great. Those things are great. Let's keep doing that. What I want to see people doing is integrating wellness into your everyday practice every single day. And we teach people how to sneak it into their lesson planning, not even planning. I don't want anyone planning. I take that word out. I don't want anyone planning. I teach people how to integrate it into your everyday practice. So that might be, for example, a rapid reset that we call. So let's say that you notice the energy level of your students, or by the way, your staff. We do this in staff meetings too. The energy level is low. People are tired, they're annoyed, they're bored. Don't ignore that. Let's not ignore that. First of all, notice yourself there and take the burden off yourself. We teach you to notice what's actually happening in your body. It's a nervous system response. When that's happening and you notice the people that you're trying to engage aren't engaged, that's all right. Let's shift the energy. So let's be intentional. Let's do what we call a rapid reset to raise that energy up. Or sometimes we have a lot of talking, a lot of noise that we're uncomfortable with. And we're feeling a little bit out of sorts because of that. And we need our students to lower that energy, or our staff to lower that energy. We can sneak strategies right in there to very quickly bring that energy level down. And it never hurts students to do it. So nobody will ever be mad at you for it. And you can do it in 10, 30 seconds. So those are just things that we can put in throughout your whole day.
That's awesome. And thank you for sharing these various strategies and techniques, as you indicated, to embed more health and wellness strategies in our day-to-day practices. You shared so many nuggets, so many strategies. What are some of the services? I know you have a consultant company, you speak and you provide resources and services to schools and districts. So, share with us some of the services, some of the programs you offer, so the school leaders that are listening, emerging leaders, could avail themselves and maybe use it for their schools and districts.
Mm-hmm. Yeah. So sometimes we do full day PDs, 2-day PD sessions, right in person. It's so valuable to do that. However, we have some barriers with rural schools or staff members that can't always get there. So we will also do virtual summits, and we do virtual days, half days, sessions. So it's really what works with the schools that we're working with districts. For example, one of the ones we did in this past year is we showed up in August, and we might do a keynote to start off the year. And we come back in October, we do a full day PD and offer several sessions like building an inclusive environment, or responding effectively to challenging student behaviors, or managing your own mental health and wellness throughout your day. So those are different sessions they could choose from. But really, we want to provide them with the 9 skills, and we systematically do that. So we start with the staff. We'll come back. We might do a virtual session in April. We'll have monthly sessions where we meet up and people can come meet and dive deeper into each of those skills. And then what we have to do is get parents on board. There's a whole system to do that. There's parent engagement funds. A lot of people don't know what to do with that. We say, equip them too. We also do a study guide that we created a whole kit so that people can just get the books. A lot of people do it for their staff. And it's a great way to bring their staff to do these conversations around these skills. And it's very much like anecdotal, right? Let's cater this to my problems right now, and let's talk about that. And by the way, let's bring parents in from our community so we can all do this thing together. So there's lots of those strategies. Ultimately, we can do this virtually. We can do it in person. We can do the hybrid approach. It's whatever the needs are. But we always work with districts and say, let's talk about what your need is and let me fill that for you. Let's come up with a plan for you.
That's awesome. And to all of the listeners that are listening, we encourage you to definitely reach out to Charle and her team to come into your schools or district to really provide the type of resources and services that she provides. I know we will avail ourselves to some of the resources and PDs that she has. So we encourage all of you listening to do the same. As we wrap up, share your favorite book or quote and why.
Ooh, I always love Wayne Gretzky's, "You miss 100% of the shots that you don't take," because we are so afraid to take risks in our culture and in our roles. And I think as long as we create a safe space for that to happen, we've got to take those shots if we want to have any kind of change. So that's one I absolutely love.
And listen, nothing happened. Thank you for sharing that. Nothing will change unless we take some risks, unless we step out of our comfort zone and really do something different. Bring the PD that your teachers, your staff need, feed them so they don't eat the kids. So thank you so much for sharing that. Again, thank you for coming on the podcast. Tell everyone listening, how can they connect with you and ultimately also buy your book and use your services?
That's awesome. Thank you for asking. They can just go to thrivingschool.org. Everything is there. Or please email me. I'll be happy to answer questions. I answer them directly. I don't send them off to somebody else. My email is Charle, CHARLE, @thrivingschool.org. And I'm all over Twitter too. So please just reach out. No problem.
Charle, thank you for coming on the podcast. Truly appreciate your time.
Thank you so much for having me. I appreciate the conversation.
Thank you for joining me today. Please consider subscribing to the podcast, leave a 5-star rating and a comment, share this episode with a friend, and on social media. Follow me on Twitter, Instagram, and Facebook for leadership ideas and tips. Again, Thank you for joining me today. Until next time.